I'd now like to introduce Avril Gleeson, the clinical nurse specialist at the Mercy University Hospital in Cork. Avril's going to update you on how to keep safe and what to expect when you come to clinic. I know in these difficult times it can be a very nerve-wracking experience, but I'm sure you will all get reassurance from Avril's talk now.
Welcome everyone to our event here today, and thank you for listening in. My name is Avril Gleeson and I'm a haematology clinical nurse specialist here in the Mercy University Hospital in Cork. I work alongside one of the consultant haematologists here who specialises in looking after patients with myeloproliferative neoplasms. Today I'm going to take some time to talk to you about how to keep yourself safe in the current COVID-19 climate, and what to expect when you come into your hospital appointment or into your day ward for a venesection. So, to begin, I will discuss some helpful hints and tips on how to keep yourself safe and how to make informed choices about the safety of your daily activities. First on the list is hand hygiene and washing your hands properly and often. This involves either washing your hands with soap and water or using a hand sanitising gel. I'll speak a little bit more about hand hygiene in a small while. Next is practicing social distancing. This is by far one of the most important things you can do to protect yourself by social distancing and keeping more than 2 meters or 6.5 feet apart from others. You need to keep the number of people that you have face-to-face interactions with as low as possible. Next is cough and sneeze etiquette. It is very important to ensure that you cover your cough and your sneeze and to dispose of your tissue in a bin immediately afterwards. You will need to carry out hand hygiene again after sneezing or coughing. Another important aspect of keeping yourself safe is the wearing of a face covering. As I am sure you are all aware, that is a legal requirement now in Ireland to wear a face covering in places where you cannot ensure more than a 2 meter distance between people, and in public indoor places such as shops, hospitals and on public transport. I'll talk again a bit about how to wear your face covering correctly in a moment. Next, another important aspect of keeping yourself safe is keeping your environment clean and cleaning frequently touched surfaces. So this applies to us at home and in our work environment. These surfaces that would be frequently touched include door handles, phones, toilet handles and flushes, your computer, your desk at work. Another important aspect of keeping yourself safe is having or considering your own risk factors and avoiding unsafe activities. So when I talk about looking at your own individual risk factors, these may be things that include your age, your underlying illness, or other illnesses you may have, such as heart disease or lung disease, obesity or diabetes. These are very important factors to take into account when considering or making decisions about different activities. When deciding to undertake an activity, for example, calling to a friend's house or going to the shop, it is important to ask yourself a few questions. How many people may I encounter at this visit? Will people adhere to social distancing? Am I in a position to ask them in advance if they have any symptoms of COVID-19? It's assessing the risk versus the benefit of the activity. The more people you interact with and meet, the higher the risk of getting COVID-19. Another aspect is the activity indoors or outdoors? when activities aren't taken outdoors, we are able to social distance correctly. Another aspect of keeping yourself safe is keeping yourself active and healthy and your mind busy. We need to look also at measures to reduce your risk when you are out and about. For example, if you are going to get petrol or diesel, when you're using the petrol pump, ensuring that you sanitize your hands after touching the petrol pump, or in and out of a shop, or using a gate, sanitizing your hands again after touching these surfaces. Another handy tip for when you're out and about is to ensure that you have your hand sanitizing gel and a face covering with you at all times. It is handy to have a set in the car, but also in your handbag or your coat pocket when you're out and about. Another top tip, and one to keep in mind when out and undertaking your activities of daily living, is to assume that everyone has coronavirus, and also to act like you have the virus and that you don't want to pass it on to anyone else. This is very helpful when doing your daily jobs around and when you're out meeting other members of the public. Next, I'm going to talk about hand hygiene, and this is in the context of keeping yourself safe and also when coming in to attend hospital appointments or attend the day ward. I'll just run through the steps of how to use the hand sanitizing gel correctly, and I'll also speak then about taking on and putting off your face, or putting on and taking off your face covering. So we only use hand gel when our hands are clean and not visibly dirty. If they are visibly dirty, you will need to use soap and water at that stage. So I just have some hand gel here for the purposes of demonstration. So pop on your gel and ensure all the surfaces of your hands are wet with the alcohol-based gel. I'm rubbing my hands palm to palm, front to back, interlacing my fingers and getting in between the finger webs. Then I'm interlacing my fingers, rubbing the backs of my fingers and my knuckles on both sides. This should take 20 to 30 seconds to complete in full and correctly. Then I'm getting the tips of my fingers and rubbing them against the palm of each hand. And then I'm ensuring I clean or make sure that my thumbs are cleaned also with the gel. And lastly, the wrists. Let's start with the wrists and make sure that they're done as well. So at this stage, the gel needs to be dried in fully before the hands are correctly sanitized. And at this stage, my hands has absorbed all the gel. So another tip at home is to have your hand sanitizer inside the front and back door of the house, so that you, on coming into the house, will use it before touching any other surfaces within the house. Also, once our restrictions allow us to have visitors in the house again, it is important to encourage any visitors to the house to use the hand sanitizer on entry into your household. And again, as I said, it's important to carry one on your person at all times. Now, next I'm going to talk about how to wear a face covering correctly. So as I said, it is a legal requirement now in Ireland to wear a face covering indoors. Now, I'm sure we're all used to wearing them at this stage. However, we need to be wearing them properly to get the proper benefit of them. So first of all, when wearing a face covering, you should clean your hands, as I just demonstrated, with your alcohol gel. Your face covering should be kept in a little plastic bag that is sealable and waterproof. I have a face covering for the purpose of demonstration here today. So I have my hands cleaned at this stage, as I've already showed you. I'll take my face covering out of my plastic bag and I'm going to put it on. So once my hands are cleaned, I can put my face covering on using the loops. You should never use the front of your face covering to put it on. You use the loops to attach them around your ears, making sure that it fits snugly and comfortably. It should go right under your chin and up to the bridge of your nose, making sure that there are no gaps at the side. So I'll just apply the face mask to show you. So I'm just looping it around each ear and I'm going to adjust it without putting my hands on the front of the mask, just right up over my nose and under my chin, and checking the sides that there is no gaps. Now my face mask is on. I do not touch the front of the mask at any stage, if at all possible. Once it is on, I should not touch my mask. If I need to touch my mask for any reason, I need to clean my hands again afterwards. Now, when I'm removing my mask, I will use the ear loops to remove the mask. So I will take one ear loop off and the other ear loop off, and I will replace it back into my Ziploc bag or my sealable plastic bag. Again, I need to undertake hand hygiene after doing so. Just a few pointers about wearing a face covering. It's important that you use the loops to put it on and take it off, and that you have no gaps at the sides, that it does not sit around your neck, that it does not sit above your mouth, that you do not wear it at the tip of your nose. It needs to come right up to the bridge of your nose, that you do not wear it below your nose. It is important to clean your hands before and after putting on and taking off your face mask. You should wash your face mask daily, and you should not use a face mask that is soiled or wet. Again, if you touch the face mask at any stage, you need to clean your hands. If you're using a disposable mask, your disposable mask can be put into the bin, into the household bin immediately, or as soon as you get home, it should be put into the bin. So next I will talk about is what to expect when you come to clinic. So there have been new practices put in place in response to COVID-19 here in the Mercy Hospital, as with all hospitals nationwide in Ireland. We have different ways of managing appointments so as to ensure the safety of patients coming into the hospital. The treating haematology team will look at the clinics and decide whether a patient is for a physical attendance at their clinic appointment or whether they will be scheduled for a telephone consultation instead. Patients will be notified by letter whether their appointment is a physical appointment or a telephone consultation. Here in the Mercy Hospital, as I'm sure is the case with a lot of the hospitals nationwide, patients for telephone consultations are required, for haematology telephone consultations, are required to have their bloods completed in their community in advance of this appointment. So this would be either getting your bloods done with your GP in your medical health centre or attending the blood room in the hospital in advance of this appointment. The telephone consultation will take place this usually the same day as the outpatient clinic runs. And in much the same manner as what it would if you were physically attending the appointment. You will be assessed over the phone by one of the medical team in relation to your MPN and your current health status. They will talk to you about any MPN symptoms, carry out an MPN symptom assessment assessment if required, and also talk to you about if you have any side effects associated with your MPN treatment. At this stage, your bloods will be reviewed and a plan for future appointments will be made. Patients who are physically attending the hospital for their haematology outpatient appointment will, in their appointment letter, receive patient information, which is necessary to have looked at prior to your arriving to your appointment. So in this patient information, there is a self-assessment to be undertaken on the day prior to your outpatient review. This self-assessment involves assessing yourself for symptoms of COVID-19, such as fever, shortness of breath, cough, loss of smell, loss of taste, new vomiting or diarrhea, and any potential exposures to COVID-19. International travel or a household member being sick, waiting for a COVID-19 swab or waiting the results of a COVID-19 swab. Here in the Mercy, patients receive a telephone confirmation call in advance of their physical attendance at the outpatient clinic also. So on the day of your appointment, I would advise patients to maybe put on their face coverings when they're leaving their car, so as that they have them on comfortably and securely in advance of coming to the hospital building. So we had asked patients to arrive at their allocated time and arrive alone if possible. However, if you need assistance that for mobility or hearing or sight issues, the person accompanying you will have to follow the guidelines as outlined. On arrival into the outpatient department or into the hospital building, you will need to wear your face mask correctly. If you forgot your face mask on the day, the reception or security guard will provide you with a face mask. You will be asked to clean your hands with the sanitising gel, and disposable gloves will not be allowed within the hospital or the outpatient department. When you are waiting to be seen by your haematology team, the social distancing practices are in place within the outpatient department, and we do endeavour to see all patients on time. However, due to unforeseen circumstances, there may be delays. On departure from the outpatient department, you will be asked again to sanitise your hands on leaving the building, and you can remove your face mask outside of the building. Again, if you have a disposable face mask, it can be disposed directly into the bin, and if it is your reusable face covering, you need to pop that into your Ziploc bag again. So I would encourage all patients to attend their, I would encourage all patients to continue their current medication and attend their hospital appointments, because keeping good control of your MPN is priority, especially at these times. They are very unsettling times for everyone, regardless of where you live or what restrictions you're under at the moment. However, again, I would encourage you to keep contact with your haematology team, and if you have any questions in relation to your MPN and others, your MPN and COVID-19, to speak with them. Thank you very much for your attention today.
Thank you, Avril, for a most interesting and informative presentation.